Western medicine has brainwashed so many of us, myself included, that your age falls off a cliff at 35 and the only option is IVF. And what I see in my practice, that's just not true.
What are some of the most common misconceptions or misunderstandings that people will come to you with, or if they haven't been exposed to like a more functional integrative practitioner?
Yeah, I would say that there's nothing that we can do to optimize our fertility. Your fertility is kind of dealt to you. It is what it is. It comes at birth. A lot of times I'll hear, well, I only have so many eggs. My AMH is low, so I have to do IVF. And I always tell people that AMH is only one parameter of your fertility health. And there's things that we can do to improve AMH. We can't make you more eggs, but we can make the ones you have better and stronger and ovulate stronger and more apt to conceiving that healthy baby. So that's probably one myth I hear is, okay, there's nothing I can do, and so I'm just going to go do IVF and that's a quick fix and a sure thing. And so that would be the second myth, that IVF is a quick fix and it's a sure thing. I always like to remind people that one, it's not guaranteed. It's similar to natural fertility. It's not guaranteed. It depends on how healthy you are, the health of your egg, and it's not a quick fix. It does work for some people, but it's definitely a long road, lots of meds, lots of stimulation. And if your body's not ready for that, it's 9 times out of 10, it's not going to work. So let's get as healthy as we can before we go down that road. And it's not a quick fix and it's not a guarantee. So that's probably the third thing, the second thing. Other myths, nutrition doesn't matter. Like nutrition doesn't play a role in our health, which I hear this from Western doctors a lot. And I think, how could they say that? Nutrition plays everything when it comes to health. It's the cornerstone of our cells and our biology, and every piece of our body needs nutrients to survive and thrive. So that's a myth that I try to bust a lot. Nutrition does play a role. It's one of the key pieces in your overall health and fertility.
Yeah, isn't it amazing for all our knowledge and scientific advancement, some of the things that still aren't agreed upon?
I know. It's crazy. I know. It still blows my mind that most Western doctors don't get any nutritional training in medical school. That should be like one of their key pieces of their training is nutrition. I mean, I don't get it, but it's what it is.
Yeah, age is a big thing in general in the fertility space, but in your experience and what you see, how big is it?
I always tell my patients is if you are still ovulating and you're still having a healthy cycle, you can still get pregnant at, I won't say every age because like you said, there is a cutoff. I would say late 40s is the cutoff. But my oldest patient was 46 years old. I helped her get pregnant naturally. I have a colleague whose oldest patient was 52 years old, got pregnant naturally. So it can still happen in our mid to late 40s. I feel Western medicine has brainwashed so many of us, myself included, that your age falls off a cliff at 35 and the only option is IVF. And what I see in my practice, that's just not true. So the healthier you are, the healthier your eggs are, the healthier your partner's sperm is going to be, the healthier you are for the rest of your life, but also you're going to have the best chance of getting pregnant and staying pregnant and having a healthy baby. All of these cases that I'm mentioning, these have all been healthy babies and just wonderful pregnancies and healthy mothers and fathers. So you can get pregnant in your mid to late 40s, but your health determines that. So get healthy now if you want that to happen for you.